The Cumberland County school system may have undercollected more than $1.1 million in insurance premiums from certified personnel, Human Resources Director Liz Broderick told the Cumberland County Board of Education during the January 6 work session. "We've got a discrepancy here. We're not being fair. We're not being equitable," Broderick said. The total cost of health insurance for school system employees is $8.7 million. The state of Tennessee provides $2.8 million for insurance premiums while the school system pays $5.5 million. Currently, employee-paid premiums bring in about $348,000 each year. Broderick estimates, based on coverage of 209 non-employee spouses, the school system should be collecting $1.45 million in insurance premiums each year. "By undervaluing the cost of the insurance that we're charging, we're artificially having more spouses jump on our plan," Broderick said. Other employers in the area, if their employees are married to one of our teachers, they're jumping on this plan, and rightly so because they're looking at the rates we publish. She anticipates some spouses may return to their employer plan if changes are made to the school system insurance benefit. Insurance premiums cost $7,344 for employee-only coverage, $12,108 for employee with children, $14,316 for employee with spouse, and $19,080 for a family plan. Broderick said current employee contribution towards insurance coverage for spouses has been $530 a year for an employee adding only a spouse, while employees with family coverage have paid $3,150 a year in premium costs. Broderick said 71 employees have an employee and spouse plan while 138 have a family plan. These are employees who are not married to a school employee. The rates used for the examples are from the Premier PPO plan, which 77% of employees elect for their coverage. "There's not a paper trail," Broderick said. "I don't know why that formula was applied like it was. The end result is giving that employee credit for the employee single rate plus that 45%. Non-certified employees get individual insurance at no cost but pay all of the cost of adding a spouse of children to their plan." Currently, annual health insurance premiums. Director of Schools Janet Graham said, "Many non-certified employees write a check because everything they earn is going to insurance. The state requires the school system to pay at least 45% of the monthly premium cost for the coverage selected by a certified employee and 10% of the monthly premium for non-certified employees." Tennessee distributes funds to school systems to help pay for health insurance benefits using the Basic Education Program (BEP) funding formula. The formula uses a state average of premium costs and pays 68.7% of that for each certified position accounted for under the BEP formula, $4,378 per certified employee. The actual cost of insurance costs in Cumberland County per certified employee is $12,812. In addition, Cumberland County has almost 100 more certified staff members than generated by the BEP formula. Cumberland County also provides health insurance benefits to retired employees, as well. If an employee retires with 30 or more years of total service in the Tennessee Consolidated Retirement System and work for at least 20 years in Cumberland County, those retirees pay for group health insurance at the same rate as certified personnel. Currently, the state splits the cost of health insurance premiums for those retired employees, paying 45% of the individual cost. However, state law changed and it will not provide the insurance benefit to any retired teacher hired after July 1, 2015. Retirees with 20 to 29 years of service and 20 years of service in Cumberland County pay 20% of the insurance costs for their insurance and can add a spouse or dependents at the same rate as certified personnel. The school system pays 100% of the individual premium for retired non-certified staff members with 30 or more years of service in Cumberland County. There is no state funding for this benefit. All health insurance benefits expire when the retiree becomes eligible for Medicare coverage. The total cost for retiree insurance coverage last year was $414,301. Possible changes could include continuing the current benefit levels, understanding the differences in cost exist, charging the actual cost to add spouses to insurance coverage, or restructure the entire insurance benefit so that everyone would pay a share of the insurance premium. Broderick said no changes could be made during the 2018 plan year. The time to do this is the next open enrollment period so people have a chance to plan, she said. The school system holds open enrollment for insurance benefits each fall and changes take place the next January. She is currently surveying other school districts in the state to determine how insurance benefits are administered for certified personnel. Cumberland County is believed to be unique in its insurance coverage, several board members said. Julia Timpson, with Cumberland County Education Association, said, "Insurance is the reason you work in Cumberland County." During a policy committee meeting Wednesday, Don Hassler, 5th District Representative, said, "We've always said we don't pay teachers as much as other places." But Graham said, "Yes, it's been a benefit to somebody, but it's been a benefit to a few people. But is the benefit fair and equitable if the 71 employees are getting something the other 500 are not?" Kim Wattenbarger, representing CCEA, told the policy committee Wednesday the formula had changed during contract negotiations in 2009-10. "I agreed to pay more because I insured more people," she said, adding she carried her self-employed husband and their children on her insurance plan. Before that time, employees had paid some for the cost to insure a spouse or children. The last contract negotiated by the board and the CCEA expired in 2013. That said, the board would pay the annual cost of individual health insurance coverage for certified employees and the annual cost of family coverage when both the husband and wife are school system employees. If a teacher selected family coverage and his or her spouse did not work for the school system, then that employee would be responsible for the cost of coverage after deducting the cost of an individual plan and the state's required contribution. Broderick said insurance premiums had steadily increased since 2010. "Maybe the gap was not as bad then," she said. "Going forward, it will only get worse." A budget committee meeting will be scheduled to further discuss insurance benefits and possible action. Graham noted $1.1 million could translate to a salary increase for personnel. A 4% raise included in the 2017-18 school budget required about $1.2 million in funds. Timpson noted a change to employee health insurance premiums could wipe out any benefit of a salary increase, though during a Wednesday policy committee meeting, it was noted salary is used to determine retirement benefits, which are based on an employee's 5 years of highest earnings. The BO is currently working with the Cumberland County Education Association to develop a 3-year memorandum of understanding through the collaborative conferencing process. Insurance is one topic the collaborative conferencing committees can negotiate. However, retiree insurance benefits are excluded from the collaborative conferencing process, Broderick said.